If you're over 60 and your vision has been getting worse, your eye doctor probably told you one of three things. Your prescription changed, you have early cataracts, or it's just a normal part of getting older. And you probably accepted that answer, because what else are you supposed to do? But here's what almost no one in that exam room tells you. For a significant portion of people over 60, including millions who have never been diagnosed with diabetes, who don't consider themselves to have a blood sugar problem, who eat reasonably well and take their vitamins, the real driver of their deteriorating vision has nothing to do with their eyes. It's happening in their blood, every single hour of every single day. And the destruction it's causing inside the tiny blood vessels at the back of your eye is silent, cumulative, and by the time you notice it in your vision, it has already been happening for years. I'm not here to alarm you. I'm here to explain something that the research has understood for over a decade, but that almost never makes it into a routine eye appointment. Because once you understand the actual mechanism, not just the symptom, but the biological process driving it, you will have something far more powerful than a new glasses prescription. You'll have a roadmap to actually slow it down. I have watched patient after patient go through the same cycle: worsening vision, new prescription, acceptance, more worsening, without anyone ever investigating why their vision was declining in the first place. And in a significant number of those patients, when we ran the right tests and looked at the right markers, the answer was the same. Their blood sugar, not dramatically elevated, not diabetic, but chronically, subtly dysregulated, was destroying the microscopic architecture of their eyes from the inside. Today I'm going to explain exactly how that mechanism works, which specific blood sugar patterns are most dangerous for your eyes, and they're not the ones your doctor is testing for. The 4 nutrients that directly protect your retinal blood vessels and have clinical trial evidence behind them. The lifestyle levers that can genuinely slow this process, and why most people over 60 are unknowingly doing the exact opposite. And the critical diagnostic test that is almost never ordered, but that tells you far more about your eye health risk than a standard glucose reading. Let's start with what's actually happening inside your eye. Your retina, the thin layer of tissue at the back of your eye that captures light and sends visual signals to your brain, is one of the most metabolically active tissues in the entire human body. Per unit of weight, it consumes more oxygen and more glucose than almost any other organ, including your brain. To support that demand, your retina is threaded with an extraordinarily dense network of tiny blood vessels called capillaries. Some of these capillaries are so narrow that red blood cells have to pass through them single file. They are the most delicate, thin-walled blood vessels in your body. And that delicacy is precisely what makes them so catastrophically vulnerable to one specific thing: high glucose. When blood sugar is elevated, even mildly, even temporarily, even in ways that wouldn't trigger a diabetes diagnosis, glucose molecules begin a process called glycation. Glycation is when sugar molecules attach themselves to proteins and lipids without the involvement of enzymes. It happens spontaneously, like rust forming on metal. The more sugar in your blood, the faster and more extensively it happens. Now, glycation in the capillaries of your retina does 3 things, and all 3 are devastating. First, it thickens and stiffens the capillary walls. Healthy retinal capillaries are flexible and responsive. They dilate and contract to regulate blood flow to different parts of the retina depending on demand. Glycated capillary walls lose that flexibility. They become rigid and narrow. Blood flow to the retina becomes inconsistent and insufficient. Second, it damages the pericytes. Pericytes are specialized cells that wrap around retinal capillaries like a supportive sleeve. They regulate capillary diameter, maintain the blood-retinal barrier, and support the structural integrity of the vessel wall. In the presence of chronic elevated glucose, pericytes are among the first cells to die. When pericytes are lost, capillary walls become unstable. They bulge, they leak, they bleed. Those tiny bleeds inside your retina are called microaneurysms, and they are the earliest visible sign of retinal blood vessel damage. Third, it triggers chronic inflammation. Glycated proteins, called advanced glycation end products, or AGEs, are recognized by your immune system as foreign invaders. Your body mounts an inflammatory response to them. That inflammation, in the confined and sensitive environment of the retina, damages photoreceptors, the rods and cones that actually capture light, and accelerates the breakdown of the entire visual system. This process has a clinical name, diabetic retinopathy, when it occurs in diagnosed diabetics. But what the research over the last 15 years has made increasingly clear is that retinal capillary damage from glycation and chronic glucose dysregulation occurs well before diabetes is diagnosed. In fact, studies have found measurable retinal vessel damage in people with prediabetes, with metabolic syndrome, and in people whose fasting glucose is technically normal, but whose post-meal blood sugar spikes are chronically high. This is the mechanism that is destroying millions of people's vision after 60, and it's being missed because doctors are looking for the wrong numbers. Here is one of the most important things I can tell you, and it's something that should fundamentally change how you think about your blood sugar and your eyes. A standard fasting glucose test, the one you get at your annual physical, measures your blood sugar after 8 hours without food. It is a single snapshot. It tells you where your blood sugar is at its most favorable moment. And because it's a snapshot of the best-case scenario, it systematically misses the blood sugar pattern most damaging to retinal blood vessels: post-meal glucose spikes. After you eat, especially after a meal high in refined carbohydrates or sugar, your blood glucose rises. In a young, metabolically healthy person, this spike is moderate and brief. Blood sugar rises, insulin responds quickly, glucose is cleared, and everything returns to baseline within about 90 minutes. But here's what happens as you get older, especially past 60. Insulin sensitivity declines. This is a normal part of aging. The beta cells in your pancreas that produce insulin become slightly less efficient. Your muscles, the primary tissue that absorbs glucose after a meal, shrink with age, reducing your glucose disposal capacity. The result is that the same meal that caused a moderate, brief glucose spike at 35 causes a higher and longer spike at 62. And those higher, longer post-meal spikes are hitting your retinal capillaries every single day, multiple times a day, for years. A landmark study published in Diabetologia followed individuals who were not diabetic and not pre-diabetic by fasting glucose criteria. They looked perfectly normal on standard testing. But when researchers measured their post-meal glucose responses, they found that the subset with the highest post-meal spikes had retinal vessel changes nearly identical to those seen in early diabetic retinopathy. Normal fasting glucose, abnormal retinal vasculature. The connection was post-meal blood sugar, not fasting blood sugar. The test that actually captures this risk is called a postprandial glucose test. Blood sugar measured 1 and 2 hours after a standard meal. Or better yet, a continuous glucose monitor worn for 2 weeks, which gives you a complete picture of how your blood sugar behaves in real life across different meals and different times of day. The other test that provides critical information is HbA1c, glycated hemoglobin. This measures the percentage of your red blood cells that have been glycated over the past 3 months. It's a rolling average of your blood sugar exposure. A standard HbA1c below 5.7% is considered normal. But research from the British Medical Journal found that retinal changes begin appearing at HbA1c levels as low as 5.5%, still technically in the normal range. If you are over 60 and your vision has been changing, and your doctor has only ever checked your fasting glucose and told you it's fine, please ask specifically for your HbA1c and a postprandial glucose assessment. Those numbers will tell you something your fasting glucose never can. The 4 nutrients that directly protect your retinal blood vessels. Now let's talk about what you can actually do. Not in theory, not vaguely, specifically with doses and mechanisms and study references. Nutrient 1. Lutein and zeaxanthin. These are carotenoid pigments found in high concentrations in dark leafy greens, kale, spinach, collards, and in egg yolks. They concentrate specifically in the macula, the central portion of the retina responsible for sharp, detailed vision. Their job is twofold. They filter high-energy blue light that damages photoreceptors, and they are among the most powerful antioxidants inside the retinal tissue itself. In the context of blood sugar damage, this matters enormously. One of the primary mechanisms by which glycation harms the retina is oxidative stress, the generation of free radicals that damage cell membranes, mitochondria, and DNA in retinal cells. Lutein and zeaxanthin neutralize those free radicals directly inside the retinal tissue. The Age-Related Eye Disease Study 2, AREDS2, one of the largest eye health trials ever conducted, found that supplementation with lutein and zeaxanthin significantly reduced the risk of advanced macular degeneration. Recommended intake is 10 milligrams of lutein and 2 milligrams of zeaxanthin daily, achievable through diet or supplementation. Nutrient 2. Benfotiamine. This is a fat-soluble form of vitamin B1, thiamine, and it is specifically relevant to blood sugar-driven retinal damage in a way that almost no other nutrient is. Here's the mechanism. When retinal capillary cells are exposed to high glucose, they activate three biochemical pathways: the polyol pathway, the hexosamine pathway, and the PKC pathway, all of which damage the vessel wall. Benfotiamine blocks the activation of all three simultaneously by increasing the activity of an enzyme called transketolase, which redirects excess glucose into a harmless metabolic route before it can cause damage. A study published in Nature Medicine found that benfotiamine completely prevented retinal damage in diabetic mice, despite sustained high blood sugar. The capillaries were structurally protected. Human clinical trials have shown that benfotiamine reduces markers of oxidative stress and inflammation in patients with diabetic retinopathy. Typical therapeutic doses used in studies range from 300 to 600 milligrams daily. Nutrient 3. Omega-3 fatty acids, specifically DHA. Your retina is one of the highest concentrations of DHA, docosahexaenoic acid, in the entire body. DHA is structurally incorporated into the membranes of photoreceptors and retinal pigment epithelium cells. It maintains membrane fluidity, supports the resolution of inflammation, and is directly involved in the survival signaling of retinal cells. When retinal blood vessels are damaged by glycation and chronic glucose exposure, the retina mounts an inflammatory response. DHA generates specialized pro-resolving mediators, molecules called resolvins and protectins, that actively resolve that inflammation and prevent irreversible damage. A study in JAMA Ophthalmology found that higher dietary omega-3 intake was associated with a 30% reduction in the risk of advanced macular degeneration. The therapeutic dose in studies is typically 2 grams daily of combined EPA and DHA from marine sources or high-quality fish oil. Nutrient 4. Magnesium. Magnesium is involved in over 300 enzymatic reactions in the body, and it plays a specific and underappreciated role in blood sugar regulation and retinal protection. Magnesium is an essential cofactor for insulin receptor signaling. When magnesium is deficient, and research shows that over 70% of adults over 60 are below optimal magnesium levels, insulin receptor sensitivity declines. Your blood sugar spikes become higher and last longer, directly worsening the retinal damage mechanism we've been discussing. Beyond its role in insulin function, magnesium directly relaxes blood vessel walls. Adequate magnesium maintains the flexibility and tone of your retinal capillaries, counteracting the stiffening effect of glycation. A meta-analysis in Diabetes Care found that magnesium supplementation significantly improved insulin sensitivity and reduced fasting glucose and HbA1c in adults with insulin resistance. Target 300 to 400 milligrams of magnesium glycinate or magnesium threonate daily. These forms are far better absorbed than magnesium oxide, which is the cheap form found in most supplements. The lifestyle levers. Most people over 60 are getting backwards. Here's where I need to be direct with you, because this section is uncomfortable for a lot of people. The most powerful blood sugar spike driver for most adults over 60 is not candy. It's not dessert. It's the foods they eat every morning believing they are healthy. Instant oats with fruit juice, whole wheat toast with jam, a banana, and a low-fat yogurt. These foods are marketed as heart-healthy, light, and appropriate for older adults. And for your eyes, specifically for your retinal capillaries, they are producing the exact post-meal glucose spikes that drive glycation damage. Lever 1. Restructure breakfast. Start your day with protein and fat before any carbohydrate. Eggs, smoked salmon, avocado, nuts. Protein and fat slow gastric emptying, which means any carbohydrate you eat afterward is absorbed more gradually, producing a smaller, slower glucose rise. Studies consistently show that meal composition in the morning sets your glucose response pattern for the entire day. A high-protein breakfast reduces post-meal glucose spikes at lunch and dinner, even without changing what you eat at those meals. Lever 2. Walk after meals. This is one of the most evidence-backed, underutilized blood sugar management tools in existence. A study in Diabetologia found that a 10-minute walk taken within 30 minutes of eating reduced post-meal glucose spikes by up to 22% compared to remaining sedentary. Your leg muscles are your largest glucose disposal tissue. When you activate them after eating, they pull glucose out of your bloodstream rapidly, blunting the spike before it has a chance to hit your retinal capillaries. Lever 3. Manage sleep. This is the lever most people over 60 are unknowingly getting wrong. Just one night of poor sleep, less than 6 hours, increases insulin resistance the following day by up to 25%, according to research from Annals of Internal Medicine. That means every breakfast, every lunch, every dinner, the day after a bad night's sleep, produces a significantly higher blood sugar spike than it would otherwise. Chronic sleep disruption, extremely common in older adults, creates a persistent state of insulin resistance that directly accelerates retinal capillary glycation. Sleep quality is a vision health issue. Lever 4. Reduce vegetable oils. Refined seed oils, soybean, corn, sunflower, canola, are extraordinarily high in omega-6 linoleic acid. When consumed in excess, they compete with and displace DHA in retinal cell membranes, reducing the retina's structural integrity and its capacity to resolve inflammation. The dramatic increase in vegetable oil consumption over the past 50 years directly parallels the increase in age-related retinal disease. Shift to olive oil, butter, and avocado oil for cooking, and eliminate processed foods that contain refined seed oils as a primary ingredient. The diagnostic test nobody orders, but everyone over 60 should have. I want to leave you with one specific actionable request to take to your next doctor's appointment. Ask for an oral glucose tolerance test, or OGTT, combined with a 2-hour postprandial insulin level. This test gives you 2 pieces of information that fasting glucose and even HbA1c cannot provide: how high your blood sugar goes after a glucose challenge, and how much insulin your pancreas is producing in response. The reason the insulin measurement matters is this. Many people over 60 have what's called compensated insulin resistance. Their post-meal glucose looks acceptable because their pancreas is working overtime, pumping out 2, 3, 4 times the normal amount of insulin to force blood sugar down. The blood sugar number looks okay, but the underlying insulin resistance is very real, and it will eventually outpace compensation. When it does, blood sugar begins climbing, and by that point, the retinal damage has already been accumulating for years. Catching insulin resistance at the compensated stage, before blood sugar has visibly elevated, gives you the opportunity to intervene with diet, exercise, targeted nutrition, and lifestyle change at the moment when they're most powerful, before the damage has compounded, before the vision loss is irreversible. Retinal capillary damage is largely irreversible once it's done. But the rate at which new damage accumulates is something you have genuine, meaningful influence over, starting today. What the research actually tells us. Key studies. Let me consolidate the evidence for you clearly. A 2013 study in JAMA Ophthalmology followed over 5,000 adults without diabetes for a decade and found that those in the highest quartile of post-meal glucose variability had a 46% higher risk of developing early retinal vessel changes compared to those in the lowest quartile. Fasting glucose was not predictive. Post-meal glucose was. A clinical trial published in Investigative Ophthalmology and Visual Science tested benphotiamine supplementation in patients with early diabetic retinopathy. After 24 months, the benphotiamine group showed significantly slower progression of retinal capillary damage, reduced microaneurysm formation, and lower levels of circulating AGEs. The placebo group continued declining at the expected rate. A large prospective study in nutrients examining omega-3 intake and retinal health in adults over 55 found that individuals consuming more than 500 milligrams of DHA daily had retinal capillary density, measured by optical coherence tomography angiography, that was on average 12% higher than those consuming less than 100 milligrams. Capillary density is a direct measure of how much of the retinal blood vessel network is still intact and functional. Research from the American Journal of Clinical Nutrition found that magnesium deficiency was independently associated with a 34% higher risk of developing macular degeneration over a 10-year follow-up after adjusting for age, BMI, smoking, and dietary caloric intake. And a 2021 review in Progress in Retinal and Eye Research, one of the field's most prestigious journals, concluded that glycation-driven microvascular damage is now understood to be the central mechanism of vision loss in aging adults with metabolic dysregulation, and that this process begins at blood glucose levels consistently lower than current diagnostic thresholds for prediabetes and diabetes. That last point is the one I want to sit with you for a moment. The retinal damage begins at blood sugar levels below what gets you diagnosed with anything, below the levels that trigger any clinical intervention, while you're still being told your numbers are fine. Your eyes are telling a different story, and now you know why. What to take away from everything we've covered. Your deteriorating vision after 60 is not simply your eyes getting old. For a significant number of people, it is retinal blood vessel damage driven by chronic blood sugar dysregulation, specifically post-meal glucose spikes, that has been silently accumulating for years. The mechanism is glycation, sugar molecules chemically attaching to the proteins in your retinal capillary walls, stiffening them, killing the pericyte cells that support them, triggering chronic inflammation, and progressively destroying the microvascular architecture your retina depends on for survival. The standard tests miss it, because they measure fasting glucose, not post-meal spikes. Ask for an HbA1c and a postprandial glucose assessment. 4 nutrients directly target this mechanism. Lutein and zeaxanthin protect retinal tissue from oxidative damage. 10 milligrams and 2 milligrams daily. Benphotiamine blocks the 3 biochemical pathways glucose uses to damage capillary walls. 300 to 600 milligrams daily. DHA supports retinal cell membrane integrity and resolves inflammation. 2 grams daily from marine omega-3s. And magnesium improves insulin sensitivity and maintains capillary flexibility. 300 to 400 milligrams of glycinate or threonate daily. Restructure your breakfast toward protein and fat. Walk for 10 minutes after every meal. Prioritize sleep. Replace refined seed oils with olive oil and avocado oil. And most importantly, stop accepting your eyes are just getting older as a complete answer. Because for many of you, the real answer is in your blood, and the real solution is on your plate. If this gave you a new way of seeing your health, no pun intended, share it with someone over 60 whose vision has been slowly changing and who has never heard any of this. They deserve to know the mechanism before the damage becomes irreversible. Subscribe for more research like this, and check out my next video on the specific morning habits that spike insulin before you've even eaten your first meal. Because what you do in the first 30 minutes of your day has more impact on your blood sugar than most people realize.